We don't mean special like they're special. Like, talking about newborns, neonates, geriatric. What is today? 6-1? There's just a couple, other than the venous access devices, there's not much left in this chapter to cover. Sorry, I think I'm getting a little bit of a sinus infection. Okay, so on page 195, page 12, it starts out talking about how children have lower total blood volume than adults. We kind of probably already surmised that, right? Brittany, Liliana, can you tell me about how many liters are in the adult body of blood?
5 to 6.
Very good. What about for females? Same thing, just like one smaller, like 4 to 6 or 4 to 5 liters. Same goes for red blood cell count, white blood cell count, platelets. There's an average. It's always a little less for females than males because of blood volume. So I'm looking here, a 150-pound adult has 5 liters of blood. Your book is stating that if you took 10 mLs in a vacuum tube out, that would equal how much of the total blood volume? 2%?
0.2.
Oh, 0.2. Who's got a calculator handy on them? Do 150 divided by, nope, I'm sorry. Do 5,000 divided by, do 10 divided by 5,000. Does that come up with 0.02?
0.002.
Okay, and when we make that percentage, it's 0.2%. How much does an infant have in their body usually? 1-year-old represents 1% of total blood volume, 10 mLs. That's a big difference between this number and this number, right? Mm-hmm. So 10 mLs out of a 1-year-old, that would be 10% of their total blood volume. And in a newborn, it's 3%, even bigger number. Okay. Infants and children should not have more than 5% of their blood volume removed within a 24-hour period unless it's just really medically necessary. Now, this is probably a rare occasion, but if you're working in a hospital, you're often taking blood on newborns, then you don't need to pay attention to stuff. They count every ml that comes out and into the newborns. Every ml, just about. Especially if you're doing something like blood cultures, you're taking a lot of blood. If you turn the page and look at this table, it gives you some more scales, like to kind of get an idea how much. Example, at the bottom, 7-pound newborn. You could take about 8 mLs out of them before you're going over one of these set standards. That's about a tube or 2 of the small ones. Any considerations about that? Any thoughts? What about just drawing in children on, in general? How do we get blood out of newborns and infants or children that are less than 2 years usually? We've talked about it. The heel puncture, also known as a dermal puncture, right? Where do we puncture the heel at? Can you give me that term?
Medial or lateral.
That's right. And so that means it's medial border or the lateral border on the sides of the heels. If you go on the bottom, you got the bone, the calcaneus, and then the tendons and nerves up here. So it's always on the meaty portion of their heel. What about a kid that's walking around? Well, you want to make sure you have all your stuff together for sure. Wish I had a better marker. I'm always wishing I had a better marker, aren't I? That's better. Not much better. What's some of the things we think we need to do for children in general? Have your stuff ready when you go in the room, right? And by stuff, I mean supplies. You don't want to go in there and like, oh, I forgot my needle. Then you go back out and you go back in, the tube's not working, you didn't bring extra. Then you go back out and you forgot a Band-Aid. That kid is just getting more and more worked up and they're anticipating the draw. Same thing for adults, but kids they tend to show their emotions a little more, right? Be friendly, cheerful, empathetic. You guys can do that, right? Explain what you're doing in children's terms, but don't ever lie, okay? Do not lie. You say, it's gonna pinch, it's gonna sting for a minute. I don't know if I'd say the word pain. What does your book say here? Do not say it will hurt, rather explain that it will hurt a little bit. It's okay to say ouch or even yell or cry, but they have to keep their arm still, right? That's why I've taught you all to hold that arm as you're sticking while you're pulling the skin down. Give them choices whenever you can. What might that look like? Other than just like, where do you want me to stick you at?
How do you want to sit, maybe?
You want to lie down? You want to sit up? You want to get my special chair over here? Do you want a Spider-Man or a Paw Patrol Band-Aid? You know?
Do you want a sucker afterwards?
Yeah, or a toy. I wouldn't worry about asking them which finger they prefer unless it's like some sick child that's had many draws done. They don't need those choices, just get her done. It'll be nerve-wracking first time you do it. The few times I've started IVs on kids, it was nerve-wracking. So oftentimes I would give them I would put Valium in like some Kool-Aid and let them drink it. I mean, the doctor gave me the order to do it. And when they were getting sleepy, then I would get their IV in. Or I would, a couple times I had to take ketamine and give them an IM injection to calm them down enough. So they're just like, you know, on Neptune while I'm sitting there working on their arm. It's called a ketamine dart. Distract them just for actual stick. Let them know it's almost over, or give them like an update. Say, keep going, we're almost done. And then make sure you praise them when you're done. Easy stuff. If you've ever worked with kids, most of us have. What about parents and siblings? Should they leave the room or stay? Yeah. Unless they're making the situation worse. They could help. Let's say you either ask them to step out or leave, depending on the situation. You'll gauge that. I've heard tell of something called a papoose. Does anybody know what that is? Think about Native Americans, early America. The baby's wrapped up like this, where they can't move. They have them at the dentist office. Those are options sometimes too. Yeah, so you got your supplies, you got everything ready. Sometimes I use this topical cream you should be familiar with. I think your book calls it EMLA. It's very common. And it numbs their skin, but oftentimes it's more trouble than it's worth. You have to apply it up to an hour before you stick. It has to be covered. Like, you'll see kids come into the office with saran wrap around their arm where they put this cream on in anticipation of this stick. And it really didn't even work because the parents did it like 10 minutes before they came in. So if that's an option, you make sure you educate your patient, that way they can kind of use it. And then they've got these little, you're on the right side of 197, it's talking about sucrose solutions. I'll come back to PKU. I saw these when my first child was born. Like, they had these little droppers you could take off, and it's like a little sugar water. And the baby would instantly be like, oh, there's glucose here. To soothe them, like maybe a child's born with withdrawal symptoms or something like that, or just totally upset. For newborns, that's an option. Kind of keep those in your pocket or snag them whenever you see them in the hospital. The only time you won't want to use that is during PKU testing. PKU testing, if you were alive in the 90s, there was this big scare that things like Diet Coke and other certain diet drinks had these phenylketones in them that we couldn't digest. It was causing like autism and mental retardation and stuff. So it became standard to test for it. It's a real condition where you're missing an enzyme to process a couple things that are in some of the foods we eat. But it's not near as prevalent or like connected to things that they thought it was, from what I understand. When you have it, it's just a rare disease, sort of like hemophilia or something like that now.
My cousin has that.
Yeah? But
She can't eat like dairy or meats or anything like that.
she lived pretty much a normal life though?
No. She's very restricted on what she can eat.
What's her cognitive status? Like, is she...
I mean, she's, you know, normal on that aspect, but like she can't eat like what we eat.
restricted diet?
Yeah.
So the fact that we do it at newborn testing allows them to have a normal life because we can identify it and treat it. Yeah. Immobilizing could be necessary to wrap them up. Receiving blanket might work for newborns. Older babies, toddlers, and young children need to be restrained. Know your employer's restraint policy. Other older children may have self-control for moving, but parents' care and attention can still be beneficial. Hey, Dad, pin this guy down. You can have him sit in a parent's lap. See some pictures here. This girl does not look happy in these pictures, does she? Just some reminders. For newborns, really, why do I want to keep that heel warm? What's going on with the physiology behind there? Same reason I would put a warm washcloth up here.
To bring the blood up to the surface.
To expand that vein.
Vasodilation, right? Brings blood flow to the surface, so and I'm here to get blood. We got these heel warmers. I'll get one out. You want to wrap them in something first. Don't put it on the bare skin. Because it can burn. Just like a heating pad for elderly adults. Like it's just a bad idea because they don't have the same sensations as we do. Babies can't say, oh, this is hot and get it off of them. And then take it away when you're done. Don't forget about it. And then the parents are halfway home and the kid's having a snack. It's just like hot hands. I think these have already been activated. Nope. So you can do it. Just fold it and you'll feel it pop in there.
It does get pretty warm.
Those cost money, right? So they're not always available to you. Maybe that one's already done. Okay. Any questions about that first part? Let's talk about some specific testing for newborns. Okay, there was PKU, that was one. Bilirubin's the next one. This is kind of cool. Let's talk about it for a minute. Bilirubin's a product that's left over after your liver breaks down your red blood cells. Bilirubin is a byproduct of red blood cell breakdown. Do I need to write that up on the board? Okay. Okay, your liver is a big organ involved in this recycling and breaking down the red blood cells. Those things can be reused, right? Body's gonna reuse some of those components. Well, sometimes when your liver is immature, like as in a newborn, or impaired, like as in someone with alcoholism, or liver-induced cirrhosis, or alcohol-induced cirrhosis, because bilirubin is not excreted fast enough, so it stays in your blood floating in high levels, and it gets deposited into your skin. It causes it to turn yellow, which is a condition called jaundice. Jaundice. It could be yellow, coloring of the skin or eyes. This white part of your eyes can become yellow. It's called the sclera. Just FYI, it's a cool medical term. Whites of your eyes. It could go long enough to where that stuff sort of solidifies in there, which is known as kernicterus. For newborns, though, we got a cool way of breaking it down called a Billy light. Put that up here in blue. It's treated. That's 2 words. Because bilirubin is sensitive to light degradation. The protein itself is broken down by light. So if it's in our skin and we want to break that protein down and let it be flushed out through our kidneys or our fecal matter, actually, specifically, we'll put UV light, we'll put the babies under the UV lights in the hospital, and that's what it's doing. It's breaking down that bilirubin so they don't have permanent lung damage or liver damage or something like that.
They have to stay a couple more days in the hospital, right?
Mm-hmm. Henry's was a little high, but we still got to go home. The doctor said, just put him by the window for a couple hours, sunny window. And that was fine. We went and we had it retested and his levels were down. So what do you think you got to do with samples for bilirubin testing? Think you can just take the blood up to the lab in the tube, all exposed to light? You gotta wrap it in tin foil like this other picture later in the book that looks, it's the crack pipe picture. Page 227. That's what I always think of when I see it. It works though. This is why a lot of things in the medical field are amber colored, like a medicine vial. It's because that medicine is broken down by light. Or oxygen tubing. It can be green or brown, or it can just be clear with a brown cover over it. Light degrades that tubing and it keeps it fresh for longer. believe it's state law. Each state has their own panel, but Kentucky has a set of tests that has to be performed, or it's by law, has to be done in every newborn. In 2006, there were 29 core things to be tested for: hypothyroidism, PKU, galactosemia. What do you think that is? Sounds like something in the blood, galactose or some enzyme. I don't know exactly. Homocysteine, I don't know. I don't even know what maple syrup disease. What the heck is that? Biotin deficiency, sickle cell anemia. Some of those rare conditions that usually, when signs and symptoms show for them, it's too late, right? All right, venipuncture in newborns. Oh, turn the page, you can see the card. This is still done today. Some of these newborn screenings, this will go to the state public health records office. It'll be essayed there or tested. If you don't get those perfectly filled out, they'll reject them. And it's just telling you about those. Pretty sure it's still done that way most places. So you'll do a heel puncture. You might have a little capillary tube that you can draw the blood up and just touch it down on that dot. And it'll just suck it out into the paper. There's other systems. Okay, for children less than 2 years, what's some of the conditions there? I see for blood draw. No tourniquet, right? That's the first thing I noticed.
Winged butterfly infusion with a 23 gauge needle.
23 gauge.
In a syringe or pediatric and vacuum.
Pediatric vacuum tubes. Maybe if they're available. Remember doing a hand draw on me the other day? One was 21 gauge, one was 23 gauge, how fast and slow each were. Do you put Band-Aids on these kids?
No.
Why?
Eat it.
That's right. Okay. Okay, let's take a break. Let's take 5. Any questions? Any thoughts? Think you have the guts to do newborns or kids? Could if you needed to?
I probably could.
I'll stick a baby all day long. I'll kick a baby. No, I'm just joking. I'm just joking. No, it's a necessary part of the job sometimes. I was always afraid to treat kids until I went to India. Then I was like, oh, kids are the best patients. And they are. I was always afraid to treat kids. I'll leave that up for a second.
Start fighting.
Man, I was the worst. I had cat scratch fever when I was a kid. I think I was about 8 or 9 years old. I had this huge pocket of pus come up in my shoulder. The doctor had to drain it through a needle in my armpit. It was a needle like that long. He had to go deep in my shoulder and drain it. It was 30 cc's of pus that came out. I remember carrying the syringe down to the lab and it was still warm in my hands. Because they thought it was cat scratch fever. I had a tick at the same time too that got real big. It stayed on there for a while. This is when I was really young. And after that, I had to go get a shot down here in Whitley City at the doctor's office every 2 weeks for like a couple months. And it was World War III when I went in with those nurses. I mean, I was swinging. And I remember one time, they just did it. They just held me down, like 3 of them held me down, just did it. I was acting like a fool. let me use the bathroom real quick and I'll come back. I'm not gonna write anything on the board for this. Let's talk about geriatric patients. Just off the top of your head, what do you think you're gonna see different in this population versus everyday blood draw versus what you know about newborns now? How about fragile skin? Easily torn, easily bruised, maybe prolonged bleeding. Keep going. What happens as we age? What happens to our organs? Do they work better?
They slow down.
They work less better, right? So their labs are automatically a little bit different for normal values.
Plus, they take a lot more medications than we do.
Very good. Medications. Less fat. Veins are usually closer to the surface. So not only does skin become wrinkly and less elastic, all the other connective tissue in their body is doing the same thing. So their veins are less elastic and recoiling. Geriatric patients, this part about feeling less control. Sometimes, I remember the first guy I ever worked on in clinicals in the VA. We were on there chatting and he needed an IV started and the nurse said, well, which one of y'all wants to start an IV? I was like, I will. He's like, can you do it? I was like, yeah, I've got plenty of experience. And I had like 4 years of starting IVs under my belt. But there was something about the way I said that he just did not like. And like he just like turned, he's like, God, get the hell out of here. And so like one of the girls started it. I don't know if he just didn't like guys or what. But I often think about that guy. Imagine what it's like, you know, I just saw my grandma being stuck in a hospital bed when your whole life you've been working, sweeping, buying groceries, taking care of your house. Now you're confined to a bed. That feels like a loss of control, right? And oftentimes, this is what people are grappling with, but we don't read it immediately. So you think about patients in the long-term care setting. Hospice. End-of-life care. You might be with a company that sends people out to get lab samples at the nursing home early in the morning. It brings them back to the lab for processing later that day. Assisted living, rehab, or other settings. Adult daycare. Home health. My friend came in to see me for my birthday a couple weeks ago. My wife threw a surprise birthday party. I'd seen him like a year. She had invited him. He works for Maxim Home Health, recruiting nurses and scheduling them. And he gave my name to one of the people he knows here in Somerset. They called me, it's like, hey, we heard you might be interested. John was like, yeah, I'm interested, but not really. I was just wanting to know what they paid and stuff and who they hired. Guess how much they were paying for an LPN on weekends, an hour for a home health nurse? Just guess, give me a number.
30.
Close. Up.
35.
$35 to $40 an hour. Yep. Home health is where it's at. You guys got job opportunities. Like I had one student that worked for an insurance company. He went to their house, did the physical and the workup. Well, they had to have blood drawn off him with that workup, and if he was a phlebotomist, then he could just take care of it too. So he was here, even though he wasn't going to work in a hospital, he was going to work for an insurance company. I think he manages a restaurant now. So give those people a little extra care. Oftentimes they could be confused, mental impairment, dementia, Alzheimer's, or complications they could experience. Make sure you're not leaving the tourniquet on, forgetting it when you walk out of the room if it's dark early in the morning. You're making sure they're done bleeding. Using small needles, it says here on page 202. If possible, use a winged infusion butterfly with a 23 gauge needle in either syringe or small volume tube. Could do dermal puncture, but you'd be there all day. Poor circulation may make this inadvisable. You ever seen grandma or a little old lady with purple fingers or cold? Yep. treat it carefully. All right. Vascular access devices. Who's ever had one of these before?
Oh, my dad has.
Technically, if you've ever had an IV infusion, you've had one. There's a bunch of different kinds. All right. The definition for a VAD is indwelling line in place that may affect. Wait a minute, it says it's a tube. No, it's not. All right. I'm going to start with the obvious one. This is a short, flexible catheter. In the AC, dorsal hand. Like you go in and see somebody that's just had surgery, they still got their IV in. And when you put the needle in, you pull the needle out and the catheter stays behind. It's only about that long. It's super soft, real tiny. Sometimes these will have something called a heparin lock attached to them or a saline lock. Okay. There's the actual catheter. Here's where it goes into the skin. This is a tube or device that's usually 3 to 4 inches long. And this will be filled with saline or heparin. It'll be a flush to keep this line patent. And it will be closed off. And then there will be heparin, which is an anticoagulant, right? Help prevent clotting. Or just water in there to keep that line patent. And it can be taped up. You can attach it, attach IV pump to it, or take it off, put medicine in it. Can you draw blood from it? No. No. Right? Your book says no. Make sure there's nothing else to say about that one. Should have left myself some more room. Read, Davina, if you don't mind, read central venous catheter, central venous line there for me.
A central venous catheter, a CVC, also called a central venous line, is the most common type of VAD. Central refers to the large veins emptying into your heart, into which the CVC is inserted. CVCs are most commonly inserted to the subclavian vein and then pushed into the superior vena cava, proximal to the right atrium. Access is gained through the several inches of tubing that sit outside the entry site. Types of CVCs include Rovaic, Roshan, Hickman, and triple lumen.
Okay. All right. So this is a tube that will go here. It will go in here. It could go in the subclavicle artery or vein. This is a venous access device. Is it in a vein or artery, Lily?
What?
A venous access device is inserted to a vein. Big subclavian vein. Once it's put in, whether it can go in the jugular. I've seen those in the ER before, subclavian, or a PICC line. They have to be confirmed with X-ray before you can use them. So a specially trained nurse practitioner or RN will come in and insert it. This is a sterile procedure. I'm talking about the end of that catheter, the tip of it will sit right outside the vena cava. Don't worry about the Broviac, Grosjean, Hickman. Triple lumen just means say there's a cap here you can attach a syringe to. There's 3 tubes inside of one, but they're all tiny. One might be for blood draw only, one might be for monitoring blood gases, one might be for administration of meds. It's just 3 in 1. Then there's the port. It's usually under skin. Has anyone ever seen one of these before? Wish my boss is here, I'd have her come demonstrate it. So it'll also have a little line that goes just to the tip, right outside the vena cava, but it happens to be right here, and it has, for patients who are getting chemo, constantly having stuff administered for some illness, you want something like that instead of a line that can come in and out in just a few minutes. Good nurses or good places that are treating people will numb it up before they access it. It has to be an RN. It's also a sterile procedure to access it. It's got like a special 90-degree needle. Sometimes accesses can be put on and left on for like 30 days, or you can take them off and it's just the skin and the port underneath. You still have to access it though. PICC line. This stands for peripherally inserted central catheter. It's inserted on the periphery. So it's threaded into a central vein, like one of those deep draining veins we talked about, after being inserted into a peripheral vein, like up here in the AC. It's accessed from the AC area. Most commonly used in angioplasty procedures. Not used for drawing blood because the tubing collapses easily when aspirated. All of these tubes, you know, that triple lumen tube, they're small already, but the tubes inside them are even smaller. So whenever you try to put any suction or you aspirate on that, it will almost always collapse it. Let me see if I got a picture right here. I just was looking at this morning, one of these devices. If I can't pull it up easily, I'll move on. I want to see how big it is in the picture. Here we go. So there's 2 lumens on this. You can see this is where a syringe will screw onto it. This might be filled with saline or heparin. But that's kind of big, you know? So we talked about what to do in the chapter I covered on video for you all about drawing from an IV site, right? First off, you don't do it. You go distal or to the other arm. You have to document what was going in. You have to tell a nurse to turn it on and off. What do you think some of the risk involved with these things? Infections, because it's going straight to your heart, right? Anytime you got something foreign in the body, you got this problem of biofilm growing. That's what I was studying this morning. I'm teaching about it in Med Micro tomorrow. Same kind of film that grows in your teeth, you have to disrupt with a brush can form on metal implants for knees and hips. These things can grow a film on the inside of them, indwelling catheters, and that's where those infections come from. Makes them especially antibiotic resistant, more than a biofilm. So they're usually protected, and they're not going to let you slide to draw blood out of it, even if nothing's being infused. Last but not least, there's AV shunts. This stands for arterio. What does it stand for? Venous shunt. Artificial connection between an artery and a vein. An AV shunts in the lower arm are used for dialysis patients to provide access for blood removal, purification, and return. It's just a fancy word for blood cleaning. There's definite job opportunities at these places for you as well.
We could apply for that?
Yeah, they get hired. They're looking for nurses and stuff too, but oftentimes they have blood draws that go along with dialysis while they're there. But I have heard and known about phlebotomists being hired at these places, like Fresenius. There's one in Wayne County too, I think. Especially if you got vital signs and CPR, because those patients are sick. I heard it's, my sister worked at one down here in Wayne County actually for 2 years while she went to RN school. They paid her RN. But these patients are often unstable, they're crashing on you. You get to know them for years, then they die. It's a little bit stressful. There's some internal and external versions of this, but a fistula is another related term. These are lifelines for those dialysis patients. You never access them, no matter what. It's strictly for dialysis. Because if they can mess up, then they're hurting bad. If you've ever felt one on a real patient, or you get the chance to, it's something called a thrill and a bruit. The thrill is the surge of blood you can actually feel, and a bruit is the sound it makes as blood is circulating in there. And I remember my teacher, she brought in an actual vibrator for us to feel it, and that's what it's like on patients. You can feel it go zzz, 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 and you can hear it too with a stethoscope. Lots of pressure underneath them. So don't stick those, okay?
Could we stick on the same arm? Could we use the same arm to stick them?
Yeah, I believe so. I don't see why not. Remember, whenever you're drawing from intravenous lines, it's going to be occasion where you will, okay? Page 204. Make sure you do your discard volume. Remember, in IV, you're going to draw, even if it's in a place in the arm without the IV, you're going to draw that first tube, throw it away, and then draw your sample. It's going to be tested, right? Look right here at the bottom of 204. It says, VADs are often periodically flushed with heparin to keep the line open. So that's why you shouldn't draw from them. For non-coagulation specimens, discard twice. For coagulation specimens, those that are involved with clotting, discard 6 times the volume that PICC line will hold. Let me see if this has this picture shows the volume in it. So somewhere on here, maybe the other side, or somewhere on this tube in the packaging, it'll have like 1.8 mLs. It'll be the total volume this tube will hold from here to the tip. So you want to withdraw 1.8 times 6 to clear that blood out of that tube and any heparin that's left over in there to get a sample you can test without being tainted results, is what they're saying. Not necessarily 6 vacuum tubes full. Any questions about that? You all can tell me what a venous access device is, different types, why they're dangerous, why we don't draw from them. They could collapse. They have heparin pushed into them. They're often a lifeline. Okay.